Okay, hi everyone. Welcome back to another episode of Healthy for My Purpose. We have a wonderful guest with us today, Miss Daphne Bascom, and we're going to have a conversation about all things plant-based, her journey, and all of the wonderful things she's doing in her life. So let's jump right in. Um, Daphne, could you just tell us how you started your plant-based journey and developed into this whole food plant-based diet? Just give us insight into your particular story.
Absolutely. And first of all, thank you for allowing me to join both of you today. You're doing amazing work, and I love seeing you spread the mission. I wish I had learned more about plant-based nutrition when I was in medical school, but I did not. I came into plant-based nutrition late in life, in my 40s, after attending an ACLM conference where we saw a pre-screening of the game changers. Um, I mean, I had started easing off dairy mainly because I was having some gastrointestinal symptoms, but had never really understood the evidence behind eating whole food plant-based until I saw all the data in front of me in this amazing documentary. And then I just went down the rabbit hole from there, and the I I can't tell you how blessed I am to be where I am today.
So I'm just curious, what personal changes did you notice when you made the change to a plant-based lifestyle?
Uh, a couple that I noticed immediately. One, I had been starting to develop some mild arthritis symptoms in my hands. It's gone. I do notice if I eat a little bit too much sugar, it can actually flare slightly, but the arthritis I was experiencing disappeared. I love to train. At the time, I was actively competing as a physique competitor, and my recovery just became, I mean, I was able to train 5, 6, 7 days a week with with less DOMs and a much greater recovery eating plant-based than I had been previously. And from a competition perspective, I probably had some of my best stage appearances as a plant-based athlete than I had as an omnivore.
So for those that don't know what DOMS is, do you want to spell that acronym out? Delayed onset muscle. Go ahead.
DOMS, DOMS, is delayed onset muscle soreness. It's that you squat on Sunday, you're struggling to walk up the stairs on Tuesday. Um, Now I squat on Sunday and I just keep going.
Okay, awesome. I was going to ask you what all the medals in the back were for. I guess you alluded to it a little bit. We'll hear more about that. But when you watched the Game Changers, did you just go home the next day and that was it? You were plant-based whole, food, or did you gradually do it? Tell us how it evolved from that one conference into how you became this now.
It was an evolution, partly because I didn't want to waste the food I already had, and I had to bring my partner along with me. Um, so the conference was probably end of October, early November, and I'd say by the time the new year came around, I had no animal products in my house, in my kitchen. The rest of it, so I initially became plant-based for health as I started understanding the impact to the environment and what we were doing to animals. I started to change my lifestyle more holistically. Um, so it really was an awakening in many different ways.
Oh wow. So you started off plant-based and then went vegan. I see your t-shirt has vegan on it. Vegan superhero. There you go. That's awesome. Yeah, so tell us, I just want to pivot a little bit about, talking about your fitness journey and everything. So you mentioned you do physique competition, and that t tell us more about what that involves, in terms of your workout routine and how you train for that.
Well, I haven't been on this stage since 2019, but at the young age of 40, I decided to enter a physique competition where I started working towards, long story short, at the age of 40, I treated myself to some personal training lessons. My personal trainer was a IFBB figure competitor. IFBB is the International Federation of Bodybuilding, and she was prepping some women for the stage while I was training with her. And it looked fascinating because it was just such a focused way of training and nutrition. And so I decided to give it a try and went on a journey for the next 7 or 8 years and was actually able to obtain my IFBB professional card. So I competed as a physique competitor in figure. And what that really entailed was focusing on muscular strength, muscular endurance, symmetry, shape, tone, really fine-tuning your physique so that you could present it on stage in a way that was competitive and allowed the judges to see your tone, symmetry, and that pretty much is what figure, it's a lower form of bodybuilding in many ways.
Yes. So how many days a week did you like tell us about your workouts or training for that? Was it strength like 6 days a week? Up and you alternate upper lower? Like how do you train for that?
All over the place. I probably, at the time, I probably did more of a bodybuilding type of split, uppers, lower. So 2 days upper, 2 days lower. Um, in the gym 4 days a week consistently. Didn't do a lot of cardio at the time under the premise that I wanted to, quote unquote, preserve my muscle. Um, and that, I mean, that was trying to either high volume or high resistance. It depended on the training phase, but it really was focused primarily on resistance training.
Okay. And it sounded like the way you phrased that you later added some cardio to your routine. I guess when you stopped competing, you did that, or like when did you add the cardio, or did you?
Well, the pandemic was an awakening for many reasons. When the gyms closed, I needed to find, so the gym for me it's a place I go for mental health, to be honest.
Mm,
I train first thing in the morning. It's a quiet time, I think. And in early 2020, when I wasn't able to go to the gyms, I needed to find a different way of seeking that solace. And so part of it, I started walking in the parking garage of my apartment building. Then I started jogging in the parking garage and I started running in the parking garage. So I started running as another way to seek the same type of probably endorphins that I had in the gym when I was lifting heavy. But after the gyms reopened, I realized I really enjoyed running.
mhm.
So I have continued, I've become more of what may be termed a hybrid athlete, and that I still lift heavy, but I run too. So um, multi-sport type of ability to continue to make progress as I move into my 60s.
Wow, that's awesome. I mean, that's like the best of both worlds, I
It
think,
is.
really just having both of those. And I remember seeing you at the ACLM conference when remember it was like 4 in the morning and I was on the bike and you walked in to go lift weights or something. I was just sitting there thinking, I really need to go over there and join her.
You're always welcome.
Because I am such a cardio junkie. I do lift I try to lift at least twice a week, and but I really need to up that to consistently doing it, probably three, maybe even 4 times a week. But you are definitely an inspiration. I mean, I was looking at your biceps, and I was like, I have like wrists all the way up my arm, and my legs are. I'm like a typical cyclist. I got these big legs and this little upper body. Like, I need to go join her right now. But anyway, but all right. So I wanna go back to the lifestyle medicine piece and wanted to just learn more about what prompted you to even go to that lifestyle medicine conference, because obviously your interest was piqued as an MD, as a physician, that you decided to register for a lifestyle medicine conference. What piqued your interest into kind of that space?
Well, fortunately, I was at the time working for the YMCA of Greater Kansas City. So I've had my career journey has been all over the place.
Mhm.
And for several years, I was the medical director for the YMCA of Greater Kansas City. And it was during that time that I really, I mean, health equity had been something that we talked about, and understanding what made people more healthy, less healthy, understanding the role of nutrition. And it was while I was working at the Y, spending some time with the diabetes prevention program, talking to community members about high blood pressure and just other lifestyle related diseases, that it started to click that a lot of this is potentially preventable. And so it was while I was at the YMCA that I attended my first ACLM conference, and realized that these are my people. And it made so much sense. Everything
Mhm.
made sense.
Yeah. While you were in Kansas City, did you ever come across a cafe called Gigi's Wellness Cafe or Vegan Cafe?
Yes, ma'am.
So you know Gigi the vegan?
I don't know her. I've been on a panel with her.
Hmm.
We've attended meetings. I don't know her personally, no,
Yeah,
but
she's
I
one of
know of her establishment.
yeah, she was on our podcast a few months back. We met her when we went there for a conference, and she's just such a wonderful spirit, wonderful personality. Her story is
Her
amazing.
story is
Yeah,
amazing.
and her food is awesome. The kale wrap was off the chain, phenomenal. Like, we went back there like days after we had it and had it again. We're like, this is so good.
So, tell us a little bit more. I know you mentioned health equity, that you worked for the Y. Tell us a little bit more about that, and if you could even explain what's the difference between equality and equity in the health space.
Mm, that is a great question. So, I I was on the board of the YMCA, and at the time I was doing some work in population health, and population health is looking at communities and groups of individuals, whether they're related by a condition, a zip code, or some way of aggregating them. But the fascinating thing about the Y is, one, they're in communities frequently that tend to um, have a higher prevalence of some of the lifestyle related diseases. They are usually perceived as safe places. So they're welcoming of people of all ages, of diverse ethnicities, races, and it's a great place also to go and provide education. So the Y was a great partner in terms of trying to engage with our community and help them learn more about things that they could do proactively to positively impact their health. And we did so in partnership with one of the essential hospitals in Kansas City. And it was just a great way of having a full circle around a community member to say, here's your prevention, here's your care, and we can do so in a holistic fashion.
Mhm.
But the health equity, and I don't know during which conference you attended in Kansas City, but you may have heard someone talk about the Troost, Troost, which is a major street in Kansas City, the Troost Divide. And the Troost was kind of a geographic landmark for discrepancies in longevity between people that lived on the east side of Troost and the west side of Troost. And so when I think of health equity, I think of, it's an opportunity for everyone to attain their highest level of health, regardless of their social status, their economic status, their demographic background. It helps reduce that phrase that you frequently hear that, your zip code is more deterministic of your health than any other code that may be in existence. But really, health equity is about identifying, recognizing, and rectifying imbalances in health outcomes. And they exist amongst different groups in our society. Equality is more of providing the same resources or opportunities to everyone, regardless of where they start. So, a good example is think about health as a tree, and you've got branches on the tree and there's various fruits. Equality is you give everyone a ladder to reach the fruit, regardless of their starting point, whether they're down here or up here. Equity means that you would give them ladders of different heights, or that you can give them different tools or different accessories to ensure that everyone, regardless of where they start, can have the same outcome. They can all reach the fruit. So that's kind of how I think about the difference between equity, which is opportunity, and equality, which is ensuring that they, they don't just have the basic opportunity to get there, but that regardless of where they're starting from, we can lift them up to help them get there.
Yeah.
So what were some of the things, just a few things that you guys implemented to actually bridge that gap? Like, what were some of the initiatives that you worked on?
Probably the biggest one was, and it's a big we, because it was, well, there's a lot of things. So I love Kansas City because they have some strong leaders in this space. A lot of it coming out of Truman Medical Center and Health Forward Foundation. But with the YMCA, we were looking, we established Ys in communities that were underserved. So we went into communities and built physical structures and brought resources. One of the Ys, which was on Linwood Avenue, I remember driving by at night, and it was kind of a glass structure, and it just brought light into the community. So bringing light, bringing hope, bringing aspiration, bringing access was what the Y wanted to do. And they did that in partnership with key healthcare providers that also saw this as an opportunity to get into the community and prevent disease rather than wait for people to show up in the emergency department or to show up in endocrinology with their diabetes or primary care. So it really, a lot of the work that was happening in Kansas City was at a community level, and it was multi-contributor. Lots of different organizations were coming together to do the work.
When I think about health equity, for some reason, my brain automatically goes to race and racial disparities for some reason. And I just wanted to ask, like, what are some disparities that you've seen that exist today as it relates to health equity?
Oh, deep breath.
Yes.
So Gigi, this is partly why HEAL is so important.
Yeah. And HEAL, just for those listening, is a member interest group that Daphne, you're a leader on. I'm a member, and it stands for, I should know this, Health Equity
Achieve Through Lifestyle.
Achieve Through Lifestyle. Thank you.
You're
Yeah.
welcome.
Yeah.
So, it's funny because I would say early in my career, I knew about health equity, but I didn't act. When I started my work with the Y and with population health at St. Luke's and with HEAL, I started to take action. And then as I started seeing things in my own family, it became a matter of lived experience. And those three together, I think, have really made this a powerful why for me. Racial disparities in healthcare, they're deep rooted and they're widespread. And things that your listeners may know of or think of commonly are, for example, Black Americans often face higher rates of high blood pressure, diabetes, and heart disease compared to their white counterparts. Hispanic and Native American populations also have higher rates of certain chronic diseases, such as type 2 diabetes. And they also, similar to many other Black, Indigenous, and people of color, face challenges with access to healthcare. When we think about, something that Dr. Bowman, for example, from HEAL is very passionate about, disparities in maternal and infant health. Black women experience higher rates of maternal mortality, and their infants face higher rates of mortality than those in white communities. And that shouldn't be the case in the United States in 2023, but it's a reality.
Yeah. So what are some of the root causes or the reasons for these disparities? Like,
Mhm.
what would you say are some of the top ones?
Oh, Sersie, they kind of get lumped into what, when I was fully immersed in healthcare, we call them the social determinants of health. I think a term that is becoming maybe a little bit more better accepted or maybe less deterministic is social influencers of health. And it's factors such as education and housing and access to healthy foods and what is the environment of your neighborhood. It is economic equality. So it's a lot of core community-based opportunities um, that impact an individual's ability to achieve their optimal health care. And those are the key things that we need to address. But one of the things that you do, one of the things that I think HEAL does, one of the things I love to do, I think education and empowerment are two of the biggest tools that we can take into any community and allow them to be advocates for their own health, um, regardless of their access to any of these other influencers that may impact their ability to be healthy.
I love that. I think that's so key because you have to give people a chance to have the information to decide. You
You do.
can't just assume,
Yeah.
you know, and because the environment is so against, lifestyle medicine and the pillars of lifestyle medicine in terms of not having access. These dollar stores are just exploding and there's no fresh produce in these
No.
dollar stores, right? I mean, I can remember I went plant-based vegan in Mississippi before Whole Foods, but it was still relatively easy because you had a Kroger, you had a farmer's market, you know, you could even go to the Piggly Wiggly
Yep.
and, get spinach and beans and whatever. And but now it's getting even harder because you've got these stores that are just exploding and they have are canned and boxed foods. Like you can't get like, leafy greens from a Dollar General. I mean, and I probably shouldn't name the name of the stores, but I'll just do it. I mean, you just can't. And and I think that you have to, and I'm a big believer in kind of a top-down, bottom-up approach to things because I do think supply and demand plays a huge role in driving market forces. So the degree to which we can educate more people at a grassroots level, the degree to which we can influence that bottoms up piece. And there are other people, like Dr. Milton Mills and others who are really working on that policy piece, and trying to influence things, more from a top-down perspective. But if you're not buying the crap, they're going to stop selling it.
Exactly. I mean, Gigi, you're right. And so going into a Dollar General, and I will name names, you can get frozen spinach and maybe you can get some frozen broccoli, but I've never seen fresh produce there yet. I'll say yet because maybe that will happen. But I completely agree that if we can make demands that we want access to fresh fruit, we want access to fresh vegetables, and there's a consistent demand, the supply has to come.
Yeah.
But we have to, probably the other thing that I worry about, especially as we share the message about being plant-based, and I want to be careful about saying that you mentioned whole food plant-based and not necessarily vegan, because we're creating the vegan demand, the plant-based demand has now created an industry of a lot of vegan junk.
Right.
And I don't want that coming into our communities and replacing the other junk, because then people are going to say, well, plant-based doesn't work. But if you eat whole foods and if you eat, I mean, you can make a lot of these, get some butternut squash, get some Brussels sprouts, get some onions, throw them all together. It's not expensive. It doesn't have to be whole paycheck, but you need to have access to it.
Yeah, because I think we have to, the message has to be to move away from the processed. Whether, because even before the plant-based industry, chips and all those things were always vegan
That's
beforehand. So we have to, it's like the message has to be getting back to real food.
Yeah.
And I think we're so removed from it. We're in the microwave culture. Maybe we're in the air fryer culture now, whatever it is. But we're so removed from the connection with our food, that I think is what we have to do. That's why I love the idea of even bringing gardens into the schools and gardens into communities, because we kind of forget that connection with the land and with our hands in the dirt, and that things come out and this is what we eat, because we're in this so highly production mode of food, and it could desensitize us. So there's just so many things that need to be done to have us fall in love with real food again, because it's like a reintroduction. Some kids, I remember growing up as a kid, you kind of just knew that, or you might have just saw your grandmother growing something, or something very connection to the land. But now kids think, oh, I bought it at Walmart. Like they have to get to another level of education to realize, well, it had to go to the farm first and then to what, like, whereas we just understood that instinctively. And so there's a lot of work to be done there, but I'm definitely hopeful that people are going back to broccoli and potatoes, and that doesn't have a name brand, that there's nothing to advertise around them. They've been around forever, and that's the thing, so yeah.
But I agree. If we can start with our kiddos and I'm guilty. I don't want anyone listening to think that I grew up understanding the value of whole food plant-based. I mean, I don't think it wasn't until I started making the connection between a chicken and chickens and where they came from, or the nice little steak that I used to make for my bodybuilding meals and the cow that it came from. I was as guilty as anyone else. But once you make that connection, you can't go back. You can't unsee it. And more importantly, I just see, I know how I feel, going back to Gigi's question. I don't feel 57 years old. I feel better than I felt when I was 40. And whether it's the placebo effect or whether it's having lots of veggies that are fueling me, I will say it's the veggies. But I definitely want to have an opportunity to have our youth make that connection, because otherwise, it's not just now you see the Dollar Generals in every community, but I'm also seeing all of the DaVita dialysis centers in all of our communities. And if we don't start younger, DaVita is going to be on every corner, just like Dollar General is.
Yep, yep,
I
yep.
shouldn't call them out either. Sorry.
No, it's fine.
You outed them, Daphne. She's like, I'm calling names.
Yeah, and just for those listening who are want to just understand kind of what we're talking about specifically is this path of, eating foods that are pro-inflammatory, that basically destroy our health and create these chronic illnesses like type 2 diabetes. And it typically starts with, weight gain and obesity, turns into type 2 diabetes. It doesn't have to be obesity, but you can still get type 2 without it. But and then the type 2 is unmanaged and gets out of control, and then it turns into other issues like chronic kidney disease, and then chronic kidney disease turns into needing to go to dialysis a few times a week because your kidneys don't function anymore. And so these centers, these dialysis centers are cropping up. It's a high growth business, and there's a lot of money in people being sick. And I think, it comes back to this education piece and kind of making that conscious choice of deciding whether you want to play in that space or not. Because a lot of times people don't tell you about it. I mean, this is why, you have fast food restaurants and hospitals and medical centers and, on every corner, because it feeds into that innate desire to want, hyper palatable food. But the cost of that is chronic disease, and then moving into this system of sick care, which is, I think the latest numbers I saw are that we spend $4 trillion a year on healthcare. 90% of it, 90% of the $4.1 trillion a year we spend on healthcare is from chronic disease and mental illness. And so, and mental illness and food also have a relationship as well, right? Because we produce most of the serotonin in our gut, and then just the mental health issues that result from being diagnosed with a chronic disease and having to go through that as well. So it's all interrelated. And so, the degree to which, you can be educated on, what food is doing to your body and how that translates into, downstream effects, because you do pay for it later. Especially the longer you go eating that way, your body kind of gets to a tipping point where it just can't, absorb that kind of abuse over time, that, you do find yourself stuck. And so, we're here to kind of educate you on that so you can make a more conscious choice for yourself. And Daphne, I want to go back to you. Like, what are some other, for those listening, what are some things that people can do, if they're listening to this, to kind of start taking action today? Like, they're listening, they're like, wow, I hadn't thought about it this way. Like, what are some things they could kind of go away and do themselves to empower them?
Gigi, thank you for that question, because I think that is important. So as a health coach, I try and work in a framework that I call the 3 M's, which is meals, movement, mindset, sleep, stress, and social connection. So starting with meals, one thing anyone listening or watching could do today, just add more plants to your plate. You don't have to go to whole food plant-based. You don't have to become vegan. Even start with maybe one meal that you like and just add more plants there. So add some black beans to your scramble in the morning, or just have oatmeal, but baby steps. And if you add more plants, eventually you start to crowd out the non-plant-based foods that are on your plate. And if you can't go from 0 to 100, then do 1%. Because if you add up those 1% over the year, you will make a meaningful change in your health. And just adding more plants, you will start to feel better, which hopefully will have you add even more plants. Second is movement. If you are active today, stay active. And that doesn't mean you don't have to go lift in the gym. I think, just watching the two of you, you can do a workout anywhere you are. Your body is one of your best resistance devices that you can ever obtain, because you can take it with you wherever you are. So when I encourage people to move, it could be just walking. It could be taking the dog for a walk, walking after a meal with your family, because that'll help bring that glucose down, and it'll help your digestion. I encourage people to set up just a little simple routine. So if you're, getting off a chair, getting out of bed, getting off the toilet, those are squats. You need to squat to live, because if you want to stay mobile into your hundreds, you need to be able to move from the chair, move from your bed, move from the toilet. So adding squats into your life is a good thing. The same with especially women of our age, and I'm making an assumption that we're probably on this call between 35 and 55 plus. Women who are going through perimenopause and menopause, I would encourage you to lift heavy, because the muscle is one, it's metabolically active, so it can help you it can help with your weight maintenance and your weight management, and also help you maintain your insulin sensitivity. It will, that activity will also help stimulate your bones, which will reduce your risk of osteopenia, osteoporosis. But the bottom line is any movement is good movement. Just walking if you're at 0 today, go for 5 minutes. And then again, small steps, 1% every day or every week to make that better. The mindset piece, I actually almost want to put at the top, because a lot of it is you have to remove your own limiting beliefs. The you can't has to go away. It has to be, I can't do it yet. And whether that's I can't have fresh food, fresh plants and fruit yet, find a way to get it. If you can't get it fresh, you can get it frozen. And that is a step forward. That is a positive step. But removing your own mental barrier, you can create your own cage in your mind. You have to break free, and you have to reframe that mindset into a how can I? And I can't do it yet, but I'm going to be able to do it. Let me pause there. Sorry. I'm on a rant.
No, you're doing great. I'm totally.
No, this is awesome. You're just taking the train right home, Daphne. So take a breath and continue. I'm assuming you're going to finish with the three S's, or was that it?
I'll
Yes.
finish
All
with the
right.
3 S's.
Take the train home, Daphne.
Sleep. I think sleep is very undervalued. And I know that we're all acknowledging the importance of sleep more, both from the regenerative aspects, whether you listen to Matthew Walker, Dr. Matthew Walker, Dr. Andrew Huberman, whether you follow the Scherzai's, sleep is important to allow your brain to clean itself, to allow your body to regenerate. And saying that you don't need sleep is not correct. So having that consistent sleep-wake time is important. Having that wind down time is important. Having a wind down routine. Those are all things that not only contribute to your sleep health, but your sleep health will contribute to your metabolic health and to your mental health. The stress, finding ways to reduce stress or to manage stress. I never say stress is going to go away. It's not. It's going to be here. And there's good stress. Use stress is a real thing. So there's good stress, like I'm sweating coming on this podcast because I'm nervous and want to do a good job. That's good stress. The bad stress can be from, just the weight of the things that we have to deal with, whether it's taking care of the kiddos, family, aging parents, your job, school. Those are all stressors. that can cause distress, but you have to find a way to navigate that. And it can be as simple as doing some box breathing. There's a 2-minute meditation the Headspace has that occasionally I'll put on in the daytime if I find myself grinding my teeth, which is a bad way to manage stress. At night, I always do legs up the wall before I go to bed, just to, it's part of my wind down routine that I do every single night. But you need to find ways to manage your stress, which is probably the other reason the gym is such a important part of my life, because I'm a much nicer person when I go to the gym. And then the last is social connection. And I mean, I'm an introvert, probably a little bit of a loner, but I know how important it is to be around people. And I've got my gal pals that I can go to, the people that you can pick up the phone and call, and they will be there to help lift you up. And that's really important to have. You need your tribe, whether it's your faith community, whether it's your family community, whether it's your friend community. You can't live and walk in this road by yourself solely. And having that social connection is an important part of your overall health. And it's something that you need to foster if you don't have it in your life today.
Daphne, that was amazing. I love that 3 M's and the 3 S's. It makes it very memorable.
Yeah.
Thank you so much for your time today. This has been amazing, and I'm so glad we got a chance to do this with you. If people are trying to connect with you, what would be a good way for them to contact you?
I am on Instagram. Instagram handle is Wingman Daphne. Wingman is, my dad used to call me his wingman. So, and I have a Facebook account. I kind of use it. I won't say I'm very active. My website is wingmanwellness.com. And then a second website is called Perfectly Planted, where again, the goal is to plant seeds of positivity and empowerment. So any of those would be a good place to reach out. And then the other thing is I'm part of the vegan gym. So we talk about being vegan superheroes. So I am a health coach at the vegan gym, and we are on a mission to help 1 million vegans get in the best shape of their life, because we think that is the way we are going to spread veganism and have a healthier, more sustainable, hopefully happier life for everyone.